wonderful good day. This is Owen McCafferty. I'm speaking thanks to the kindness of Professional Fusion. The topic of today, very short one, is your health and the necessity for scheduling appointments. Now, this is the time of year that everyone scrambles to gain access to a physician, a dentist, maybe someone for specialized knowledge or an elective procedure. Because it's getting close to the end of the year when new deductibles may be popping up for many of us in our insurance policies on January 1st. So getting an appointment, especially now, is somewhat of a challenge with physicians and dentists and other health care providers. But it's so essential for the health of your practice to know that you're okay. And for you to be okay, that means that you have to have a very good knowledge of if there's any challenges, health challenges that you may have to face, because that's going to affect the planning for the practice. Too often, people just will avoid that kind of discussion. But if you're looking at something that really does make a big difference in terms of the health and the profit of your practice, it's the protection of those key producers. And usually the practice owner is the key producer in the practice. If not in the examination room or the surgery suite or the operatory, that person is going to be key from the standpoint of directing the operation of larger practice groups. So, by the way, I am sorry for the chiming you hear. That's the Microsoft version that we use to let us know that someone else is sending an email to us. So apologize for the chimes. Now, what are you going to do? I would say right now I'd be calling for appointments. You may want to select also your healthcare provider based upon their plans. So, for example, if you're planning on having a replacement of a body part like a knee or a hip. And I can speak with some authority because 5 weeks ago I had my left knee replaced. You have to concern yourself not only with the competency of your surgeon, but also their willingness to stay over an extended period of time and not retire. Many physicians are retiring way too soon, especially surgeons. And if you have to have a follow-up replication, as I will probably have to have, where my right knee will be replaced, you want to select a surgeon that knows you, knows the peculiarities of the case, and will be available for part deux. So it's more than just trying to gain an appointment. It's the strategic assessment of the longevity of the person with whom you're dealing. Now, in the old days, you would rely upon an institution and that they would always be hiring the finest and the best. Well, you can't depend upon the institutions anymore. And in fact, those institutions are becoming overwhelmed with massive caseload. Some of my friends have gone the route of engaging a concierge physician. And sometimes concierge physicians are engaged at major medical centers where you will have then access on a prima facie basis to medical care that those of us, myself included, that are not part of the concierge community are not afforded. So, for example, I had to wait 3-4 months for my surgery in a journey that began basically 14 months ago. And at the point I finally did decide to have the surgery, it took time. I'm not obviously a member of the healthcare center's concierge group. A real close friend of mine had another medical issue and needed a surgery, an orthopedic surgery, and he was able to gain access within 3 weeks. So it does pay if you have the wealth and you can make the payment to engage a physician or a physician group as a concierge doctor, because they seem to be able to gain access to the medical system that just the normal Joe like myself would have to wait. So that's something to consider. Philosophically, I have problems with trying to jump ahead of somebody else, so I don't engage the concierge, but I do deeply respect anyone who does, because in the words of Milton Friedman, you are always free to choose. So what I am saying is take care of yourself. Make sure that you can gain surgeries at a young enough age so that you can pull through them rather effortlessly. I was able to get back to work within 2 weeks after my knee replacement. I was not in a walker nor a cane, but was able to walk upright like any Homo sapien would like to be. And but I did it at an age when I knew that I really had no major medical issues. You may want to start to look too, if there's elective surgeries that you know you'll need, getting them sooner rather than later in a practice group makes a lot of sense. Okay, so you're watching what you're doing, you're staying on task, you're getting all of the great diagnostics that are available to us today that heretofore were denied. What that is going to do is to allow you to stay in your individual practice a lot longer and provide care to your patients or, as in veterinary medicine, to your clients and patients in a way that will assure the longevity. Remember when I said a little earlier that when you choose a doctor, you have to worry about their longevity? Well, your clients are probably choosing you or your practice group in the same manner, and they want to know that you're going to be around. So the best way to ensure that you are going to be around is to take good care of yourself and to encourage those other doctors and key personnel, and as that matter goes, everybody in practice, that they do similar things to protect their families and themselves and the practice by ensuring that they're in top health. Not seen as a discussion area in many of the videos, but I think something that's very important. And if you're in a profession with a body of knowledge and a code of ethics, you owe it as part of your duty to your patient client to ensure that you will be there and available to serve them. Also, if you take a proactive route, you can choose to have procedures performed or health risks monitored at your convenience instead of the necessity of a desperate moment. So with all of that in line, I know you can't eliminate unfortunate news that comes around, because let's face it, we're all human beings. But try to mitigate it for the good of your practice, for the health of your patients, and for the safety and the longevity of your family. So this is Owen McCafferty. Again, thank you very much. Hope to talk to you in a bit. Bye-bye.